My name is Emily Liu. I collaborated with the HealthTree Foundation over this past summer working on their research with multiple myeloma. We wanted to look into what medical conditions of certain multiple myeloma patients would increase the risk for contracting COVID-19. Because during this time of the pandemic, many patients who are considered high risk, including cancer patients, were very concerned on what things they can do in order to take precautionary measures so that they do not contract COVID-19. So some medical conditions that we investigated included whether the patient had a heart condition, whether they suffered from a neuropathy condition or a kidney condition, whether they were overweight or their BMI specifically, as well as their Mediterranean descent, their smoking history, as well as their drug use history. Through a statistical analysis, we were able to find that patients who were overweight were 2% more likely to contract COVID-19, and that other patients who were suffering from certain conditions such as heart or kidney or neuropathy conditions were actually less likely to contract COVID-19. A second part of our analysis was to investigate patients who did contract COVID-19, which one of their medical conditions made them more prone to suffering from more severe COVID-19 symptoms. The severity of COVID-19 symptoms, we term that as whether the patient had to go to the ICU, whether they needed to get a D-dimer test, or whether they needed to get oxygen therapy, and we term that as, their severity. So it's interesting to find that patients who contracted COVID-19 and were overweight were 12% more likely to suffer from more severe COVID-19 symptoms. Okay, so in consideration of our results, we found that these results were actually not significant, but as a statistician, it makes sense to me because simply because of the population size. If there's not a lot of data, it's difficult to draw statistical conclusions. So I believe future steps that we can take to further our investigation research is to, maybe possibly increase our sample size. We can also look into different interactions between medical conditions, which means, whether a patient had both a heart condition and a lung condition, how would that affect their risk in contracting COVID-19 as well.